I think that 2015 has been a building year for Village Life. We've had a lot of exciting accomplishments, but to hit some of the highlights, we have started construction on the staff housing at Roche Health Center, which allows us to attract some high-quality medical staff to fully staff the center. We finished a well project in Nambogo that offers fresh drinking water to thousands of people. And we've also done a lot of structural stuff on the Cincinnati end. We've expanded our board and are doing some really exciting things in leadership here.
Mama Maisha is a safe motherhood project which started fairly recently with Village Life. It has been met with a tremendous amount of success within the villages, and the goal is to be able to continue to expand that and provide options for mothers who are trying to receive care. One of the biggest successes we've had has continued over the years, and that is with our project in schistosomiasis treatment. Schistosomiasis is a parasitic infection that's very common in the areas that we visit. So we have followed the World Health Organization's protocol, and we treat annually for schistosomiasis in all school-age children and also in at-risk adult populations as well. Additionally, we are starting rapid diagnostic testing for malaria, which is going to also really improve our ability to accurately treat the patients that we're seeing in the communities.
The Roche Health Center began in 2008 as a result of conversations between Village Life and the community of Roche, looking at what they needed for their community. And they identified that what they really needed was a permanent healthcare facility. We had an amazing year last year when we had tremendous support from UC Health, who stepped forward with some significant funding that allowed us to get moving with actually building the staff housing. We're really thrilled with the progress that we're making, and we are hoping to have that completed or predominantly completed by the end of 2015. And then we're going to quickly roll into another building, which will be additional staff housing or dorm housing. The full master plan for Roche Health Center involves 14 buildings and extensive landscaping and infrastructure. And we've designed it in many phases based on the sort of needs that are identified as it develops and as the community develops, as well as the funding available.
As chairperson of the Education Committee, my goal is to expand the nutritional program in all 3 villages and also to enhance the bike program. The bike program is mainly for high school children, where children are provided a bike through the school to ride to school each day. They stay within the schools, so you don't take the bikes and just keep them. They're passed on from one grade to the next. And those bikes go about $100 a piece. So you can buy a bike, but it will last for many years and that the children can use. The nutrition project for Village Life is to provide a nutrition known as uji. And uji is corn flour and it's mixed with water and sugar. And as you can see, it needs a little bit more in it. So our hope for the future is to expand that by adding something more nutritional. Something that's going to give the children protein as well as those carbohydrates that are part of it. We're also looking forward to expanding it to the other 2 villages because we're talking about 1,200 children now and then add 2,400 more. So I'm hoping that as we move forward that we can let others know about this program and the good that it's doing.
Well, about a year and a half ago, 2 years ago, Village Life came to emergency medicine. The 2 groups got together for Village Life to expand their focus a little bit in Tanzania, to try and broaden their exposure from day clinics and small clinics and so forth to include emergency medicine into their long-term plans. Coming up in October, we hope to accomplish 2 major goals. One is just to provide very good care to the people of the 3 villages that Village Life sees yearly. They have these long-term experiences there, long-term relationships with the patients. They see the same patients over and over again as they travel. So we certainly want to fulfill that need for Village Life. Secondarily, we want to try and expand the role of Village Life within the Sherati hospital system and see how we can incorporate emergency medicine concepts and provision of care into that hospital itself.
We are continuing these larger numbers on our brigade, so in October we're taking our largest brigade ever. We're hoping to keep those numbers up for 2016. Like in the past, October will be a medical center brigade, but we're also going to take students in March, and we're hoping to continue the process of having students on the ground almost all year round and sending people in between the March and October brigades. And I love that we get to expose Cincinnati to a part of the world that I think a lot of people don't really get to see.